Bismillahirrahmanirrahim. Assalamu alaikum. My name is Mavish Saad. My roll number is BP1450117. And the topic on which I am going to present today is Niclosamide. Let's move on. Anthelmintic. Anthelmintic are a group of antiparasitic drugs that expel parasitic worms and other internal parasites from the body by either stunning or killing them, and without causing significant damage to the host. They may also be called vermifuges or vermicides. Antihelminthic are used to treat people who are infected by helminths, a condition called helminthiasis. These drugs are also used to treat infected animals. Niclosamide. Niclosamide is an antihelminthic used for the treatment of tapeworm infections. Helminths are multicellular organisms that infect very large numbers of humans and cause a broad range of diseases. Mechanism of action: niclosamide works by killing tapeworms on contact. Adult worms are rapidly killed, presumably due to uncoupling of oxidative phosphorylation or stimulation of ATPase activity. The killed worms are then passed in the stool or sometimes destroyed in the intestine. Niclosamide may work as a molluscicide by binding to and damaging DNA. Indications: for the treatment of tapeworm and intestinal fluke infections, beef tapeworm, pork tapeworm, fish tapeworm, large intestinal fluke, niclosamide is used as a molluscicide. Contraindications: hypersensitivity of niclosamide. The common side effects include abdominal pain, diarrhea, loss of appetite, nausea, vomiting, and etc. While the rare side effects include dizziness, drowsiness, itching of the rectal area. And the drug interaction is: the metabolism of niclosamide can be increased when combined with abatacept and with adalimumab, while the mechanism of niclosamide can be decreased when combined with abiraterone and with acetyl sulfasalazole. Dose adjustment: for fish tapeworm or beef tapeworm, the dose adjustment includes in adult 2 grams as a single dose, and if needed, you can repeat this treatment in 7 days. And for children, in children, the dose is actually based on the body weight of the children and must be determined by your doctor. So the children whose weight is 11 to 34 kg, 1 gram should be used as a single dose, and for the children whose weight is over 34 kg, 1.5 grams as a single dose. And for dwarf tapeworm, in adults, 2 grams a day for 7 days, and if needed, treatment may be repeated in 7 to 14 days. And in children, for children weighing over 34 kg, 1.5 grams on the first day, then 1 gram once a day for next 6 days. And for children weighing 11 to 34 kg, 1 gram on the first day, then 500 milligram once a day for the next 6 days. And if needed, you can repeat this treatment in 7 to 14 days. Alternative drugs. The brand name for alternative drugs are Niclosane, praziquantel. So rational and irrational use of drugs. We have rational and irrational use of drugs. Let's first discuss rational use of drugs. Okay. Niclosamide is a clinically approved drug that has been used to treat helminth parasites in humans and animals for more than 50 years. Niclosamide appears to modulate metabolic disorders and neurological conditions and has anti-proliferative effects against various cancers. And it is an effective antibiotic against gram-positive and acid-fast pathogens. Irrational use of drug. Irrational use of niclosamide may lead to toxicity that cause several adverse effects like gastrointestinal distress, headache, rash, and fever. Some of these effects may result from systemic absorption of antigens from disintegrating parasites. Case study. Let's discuss the case study. And a 7-year-old male child presented to the medical outpatient department with complaint of abdominal discomfort, heat sensation in the lower back and passage of segments of form in the feces of, and on since 5 weeks. The infection did not affect his physical activities, appetite, and digestion. General and systemic examination revealed his RBC count, and the RBC count is equal to 4.2 million MCL, and no abnormal findings except thin bodily constitution. Microscopy examination of the fecal samples revealed ova and cyst. The patient is a non-vegetarian who relishes beef, including smoked and dried meat, regularly. So, the subjective of soap note is that the gender is male, age is 7 years old, and the chief complaint was that he had abdominal discomfort and worms in the feces, and he had this for since 5 weeks. And the objective had microscopy examination is tapeworm infection, and RBC count is 4.2 million MCL. Soap note continue. Assessment. As the child has tapeworm infection, antihelminthic are medications that are used to treat worm infections as they kill parasitic worms. Most people with a tapeworm infection got it by eating raw or undercooked beef, pork, or fish infected with tapeworm, or the people had contact with poop that contains eggs of tapeworm. Okay, so the plan is, final treatment plan is to use antihelminthic niclosamide, which kills parasitic worms, as niclosamide is used to treat tapeworm infections such as large or fish tapeworm, dwarf tapeworm, and beef tapeworm. Niclosamide kills tapeworm when they come into contact with it. The worms that have been destroyed are then passed in the stool. To avoid tapeworm infections, good hygiene must be followed, and avoid raw and undercooked food, meat, fish. Jazakallahu khaira. Thank you so much for watching. Thank you so much.